हेलो, हाँ।
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्।
Hello, viewers. Wish you all a very happy World Health Day. Health is indeed true wealth, which is why True Wealth Integrative Health Centers were established with the mission of Sarve Bhavantu Sukhina, Sarve Santu Niramaya, true wealth of holistic health and happiness for all, to reverse, control, and prevent diseases and augment health by integrating all appropriate scientific, evidence based, personalized nutrition and fitness therapies, functional medicine, and advanced surgical treatments with a holistic wellness approach. This coincides with our Prime Minister's vision of the flagship Ayushman Bharat Health and Wellness Centers initiative. Integrative health care does not mean alternative medicine. At True Wealth, eminent medical doctors, surgeons, personalized nutrition and fitness experts focus on the patient as a whole to identify and address the root cause and bring about true relief from diseases by combining ancient wisdom with modern science and bringing about a deep collaboration among health practitioners from multiple disciplines to create a comprehensive health ecosystem to help patients meet all their health needs physical, emotional, and social. Being the founder of True Wealth with 2 decades of rich global experience across continents, I firmly believe that nutrition can be modern day's most effective and safe therapy in lifestyle, autoimmune, and infectious diseases. On behalf of all of us, I extend a very warm welcome to the health experts on the panel of True Wealth's World Health Day program today and wish them best of health and happiness. Each of the panelists here today are renowned in their area of expertise, and I'm sure each of you and us are going to take home some important health insights from them today. I will take the privilege to introduce them one by one so that we can hear all the vital inputs and insights they have to share with us today on the World Health Day. I would, of course, begin the session with Dr. Amit Kumne. With 2 decades of solid experience, Dr. Kumne is currently the Director, Critical Care and Physician at the coveted Kaushalya Medical Foundation and Trust Hospital in Thane. Formerly, he was Director, Critical Care at Diva Patil University Hospital in Navi Mumbai. He's been member of the Thane COVID Task Force, medical simulation expert, trained at USA, is MRCP UK London. He was applauded very much for his work through the pandemic, and rightly so. He's going to help us understand emergency care better today and how important it is to act fast and bust some of the important myths that are related to the ICU. So, without any further ado, I would really request Dr. Komne to share his insights with us today.
Good morning, and thanks, Rajeshi ma'am, for such a warm welcome to me. I'm coming here for the first time on your platform, and I really thank True Wealth and all the organizers here for inviting uh, and asking me to talk on the most dear topic to me is ICU. So 2 days back, when we were discussing about what we should talk regarding ICU, as it is a very vast subject and it encompasses everything from simple illnesses which become critical to end of life care. So there was not a single topic what we could discuss. But then when we discussed about the audiences, which would be a general public here and being World Health Day theme, so we thought let's debunk some of the myths related to the ICU in the minds of people, because when we utter the word ICU, it immediately gets some scare and some shivers down the spine in many of us sitting on the other side of the table. Why? And hence, it is important to debunk a few myths which I had experienced myself in the minds and the eyes of the relatives when we talk to them, when we deal with them during the counseling sessions of the ICU. So let's start them one by one. So one of the first myths which comes to my mind is people think that ICU is a place where people go to die. Okay. While it is true that some patients in the ICU are critically ill, it's important to emphasize that not all those who go to the ICU they go to die. It's important because these ICUs provide specialized care aimed at stabilizing patients and supporting them through their recovery. Many patients who get admitted to the ICU eventually are discharged to home. And if we calculate the world over mortality rate, or how many people actually die in the ICU, is on an average of 14 to 12 to 14%. That means 88% of the people who go to an ICU eventually go home. So there is a great chance that once you get admitted to the ICU, you would really go home. And to make this possible, the ICU teams are working tirelessly to save lives and improve the outcomes for the patients. One of the second important myths which is there in the people's mind is the ICUs are full of infections. Yes, ICUs have people who come with infections, and the world has experienced the pandemic, which was an infectious pandemic again, and it was of COVID, right? And during these, ICUs played a very important role in making sure that people recover from the deadly virus. So ICUs are actually equipped these days with very much stringent infection control protocols and measures to prevent the further spread of infections among the people who are admitted in the ICU. And these are by various methods incorporated. There are separate teams called as infection control teams, which are aptly headed these days by microbiologists or infection control officers who can be a microbiologist or an intensivist, and they manage various protocols and various methods by which uh, interspread of infections among the patients admitted to each other's bedside, the spread is prevented. These measures include a lot of simple measures like frequent hand washing at the bedside, wearing protective personal equipments, what we call as PPE. You must have seen the PPE. Every doctor, nurses, and the staff, as well as the paramedical staff, donning themselves the PPE and working tirelessly throughout in the ICU. So PPE is actually a part of preventing infections from getting transmitted from the patient to the doctor and from the patient to another patient. Sterilizing equipments are used very much in the ICU, and even the surface sterilization and implementing protocols to reduce health risks. So ICUs, yes, they are full of infections, but care is taken that the infections do not spread amongst each other or from person to person. And hence, one of the next myths which comes to the mind related to infections is that ICUs do not allow relatives to meet the patient. This has been a regular complaint from most of the relatives that we need to see our patients at least 4 to 5 times a day or be with the patient in the ICU. However, due to the stringent infection protocols, infection control protocols, this may not be possible at all the times. Yet when things on a compassionate grounds are considered, one-to-one decisions can be taken depending upon the index case. Hence, because we have to prevent infections amongst infections, the footfall to the ICU has to be limited. The visiting hours have to be limited. The people who are going to visit have to be limited. Even the people who are going to visit the ICU sometimes may need to don a PPE or simple protective measures like cap, mask, and gown. So this, I think, debugs most of the myths related to the ICU and the infections around it. Another myth is that patients in the ICU are always unconscious. This is not true. Some of the patients are unconscious by the virtue of the disease itself, and some of the patients in the ICU may be sedated or induced coma. That is what we call as induced coma, or coma induced for their medical condition or due to their medical condition, which facilitates better recovery and better ventilation or better mechanical instruments around them. And this induced coma can be reversed whenever the medical condition improves. So it is not that always the patients are unconscious in an ICU. The ICU care is all about machinery and technology. This is another myth which is there. No, and yes as well. These days, ICUs have become technologically very much forward, and there are a lot of machines there in the ICU which help patient to improve from to the point of they get admitted. However, apart from technology in treating such patients, compassionate human care also is at the forefront in the ICU these days. There is always a team of skilled healthcare professionals, doctors, nurses, even paramedics like respiratory therapists, physiotherapists, who provide comprehensive and tailored care for each patient's needs. So it is not always machines that are being taken for the care of patients in the ICU. Another myth is that ICU is for the care of elderly only. It is not this way. ICU caters to a lot of patients from all ages, ranging from newborns, neonates to elderly and critically ill. The decision to admit a patient to the ICU is always based not on the age solely, but also on the severity of the condition and the likelihood of benefiting from the intensive care measures that would be taken regardless of the age. Another myth here is ICUs are always long stay and indefinite. They say that once they go inside the ICU, the patient is going to be there for indefinite period of time and for longer stays. While some patients may need required extended stays in the ICU, it is not always true. Some patients are very there for very short period of intensive care before transitioning them or shifting them to a lower level of care. For example, patients who are there for monitoring after an operation, patients who are there for monitoring for a critical period of an illness, and once the safety measures are okay, hence, and then the patient can be transported back to the general ward or the rehabilitation facility wherever the patient has come for. The length of an ICU in the patient of a patient usually depends upon various factors, including the nature and the severity of disease itself, or the injury, the response to the treatment, and the overall health status. So it is not always true that once in the ICU there would be an indefinite and a longer stay in the ICU. Another thing, patients think that patients who come back from ICU end up with disabilities, either a physical or emotional disability at home. Yes, this is true for some patients that may experience some physical or cognitive impairments or psychological related impairments at home once they are recovered. They have recovered completely from a very sick illness for a longer time in the ICU. And however, with period of time and with good rehabilitation, these patients resume back to their normal activities. During the ICU stay, to prevent such post-ICU disabilities or post-ICU emotional disturbances, the ICU teams prioritize a few things which help them to prevent such conditions. What do they do? Now they prioritize early mobilization. The ICU teams are there which make that the patient is mobilized early. I'm sorry, patient is mobilized early. There is a rehabilitation team that takes care during and after the ICU stay of the patient. And there is a lot of supportive care to minimize the risk of complications and optimize the patients for the long-term outcomes. The advances in critical care medicine these days have led to an improved survival rate and reduced long-term disability among patients in the ICU as well. Yes, another important myth is that the ICUs are too expensive. Most of the times, whenever we are talking to the relatives of the patient, one of the important questions in their mind is when is their patient going to get discharged? When is the patient going to get discharged from the ICU as such? Or when are you going to shift my patient back from the ICU? And this question stems largely because many of them think that the ICUs are too expensive and the expenses would be too high as long as the patients are kept in the intensive care unit. Yes, while it is true, it is absolutely true that the cost of care in an ICU can be higher due to specialized and personalized care that is being delivered these days in the tertiary and the quaternary ICUs of our country and even abroad. Because of the specialized equipments needed there, skilled personnel involved there, and intensive monitoring with the technology and machines that is being there, the cost of care can improve. However, it is prudent to note here that this level of care will prevent further deterioration of patient's condition, will reduce the need for additional medical interventions which are needed in a case which becomes later out of hand. And ultimately, the long-term healthcare costs by facilitating a faster recovery in a very personalized and specialized care in a shorter ICU stay will prevent such long-term costs. So the short-term costs are more basically in view of a long-term healthcare morbidity and mortality that can result if there had not been an ICU stay. Another myth is that the patients in ICU are always on life support. So yes, it is true partially there, but not always everybody is on life support. There are various types of life supports involved in the ICU. One is ventilator that most of us know that whenever there is a breathing difficulty or a lung failure or respiratory failure, they need ventilation so that is kind of a life support for lung. So more than life support, we call these days as organ support. So each organ separately needs a support to maintain its vital functions when the organs fail. For example, when the lungs fail, we put them on ventilator. When the heart and the blood pressure fails, we put them on certain medications called as inotropes, and then we put them sometimes on the heart-lung machines or ECMO that is there. When their kidneys fail, we put them or we start the dialysis for them. So mechanical ventilation, dialysis, ECMO, these are all external supports that are given to the organ to prevent further failing and improve, and over a period of time, help them improve on their own in the ICU till the basic condition or the basic ailment is taken care of. So not always all of them are on all the three life supports or all the 4 5 life supports that we spoke about. One or other life support is needed for at least 50 to 60 patients at some point of time given in the ICU. So some of the patients are there in the ICU just for monitoring and for close monitoring so that they do not need these supportive therapies, and hence the myth that everybody is on life support remains a myth only. Many patients in the ICU are for what we call as a palliative care or end of life care. What is end of life care is for patients who are into terminal illnesses like cancer, and when the treatment is not going to help, and when the cure is not going to be achieved with the current medical treatments that are available in the world, or when the patient or the families themselves have decided to opt for a palliative care and not for a complete curative care, ICUs are better places where palliative care or end of life care can be performed as well. And this involves a lot of symptom management, mainly in terminal ill patients. They have experience of distressing symptoms such as severe pain, breathlessness, confusion, and anxiety. Now, optimal management of such severe pain, breathlessness, without much of a machine intervention can be taken care in specialized ICUs, where who specialize basically in palliation and palliative care. That is what we called as a dignified end of life care or comfort care for such patients. And as well as emotional and psychological support is arranged by the specialized teams for such patients, which involves communication, shared decision making amongst the doctors, patients, nurses, as well as relatives and the patient themselves. So I think these are a few of the myths which came to my mind. I think we should they need to be debunked, and I think if Dr. Rajeshi can get me more myths, I will be able to clarify them more. This is it from my side as of now. Thank you, Rajeshi.
Great. I think, ICU does not always mean long stays or fatality, and comprehensive care, not just machines. I think we've really learned a lot of insights from you, and I think such reassuring words coming, especially from you, Dr. Komne, I think is really going to help build more hope and faith amongst the audience. I mean, I think that's one thing which, as an ecosystem, we all need to, start developing about each other, about the healthcare professionals, about the patients. All of us collaboratively need to work towards it. So, thank you very much for sharing so many important insights here. A lot for me to also learn out of it. And as you say, millions to treat before I sleep. So, we wish
Billions to
you,
save before I sleep.
yes, and we wish you all the very best in that
Thank you.
mission. And of course, today we would, of course, wish you best of health and happiness that you're actually giving everyone each and every hour, every day.
Thank you.
So, in the end, I think if there are any questions, we will, of course, come to you.
Okay.
Uh,
Thank you.
Moving on, of course, with medical treatments, the next paradigm really is surgeries. So our next speaker is Dr. Prashant Sarvi. He is minimal invasive metabolic and bariatric surgeon at the Jupiter Hospital, Thane. He is MS General Surgery and has extensively trained in bariatric and metabolic surgeries at Asia's highest volume bariatric center with formal university fellowship in minimal access laparoscopic surgeries. Dr. Prashant Sarvi has an experience of managing more than 2,000 bariatric cases, and his focus is comprehensive obesity care. Surgery has made so many advances over the decade and is making advances as we speak. Today, Dr. Sarvi will help us understand the importance of surgical procedures and will, of course, help us alleviate the fears of surgeries. Uh, Dr. Sarvi, it's always a pleasure to have you on our platform. Over to you, honestly, without any more further ado,
So,
right?
good morning, everyone, and thank you, Rajeshri, for the invitation. Uh, Today being the World Health Day, and the motto for this year is "My Health, My Right," and which is very true because everybody should be aware of the fact that how health is important and how health would be bringing us all in a very healthy state, and it is very important also. So, I'll share my slide also. I will not take much of the time for my presentation, but it's just about how exactly obesity being a global epidemic, and on this World Health Day, I would like to focus more on obesity and the surgical way and how and when we it is utilized to make these patients free of obesity and free of their complications because of obesity. So we all know that obesity is become an epidemic, and if you go by the numbers, 2.8 million people are dying each year because of obesity and its complication worldwide. So if you talk about India, we are number third in the position for total number of obese individuals in the world. And if we go like this, the same thing continues, definitely we would be number one. And that's not a really great thing to happen. So when we talk about obesity, obesity is related to multiple comorbidities like hypertension, diabetes, migraine, depression, non-alcoholic fatty liver diseases. In young female patients, there is PCOD, which makes them difficult to conceive after marriage. And that's all the complications. Then there are 13 types of cancers which are associated with obesity. So if you see overall, obesity is called as the mother of all diseases. Now, when we talk about obesity, can we measure it? Yes, we can definitely measure it with the help of BMI calculators. So there are multiple calculators. There's a simple formula in which this is the formula wherein which you can calculate your BMI. And once you calculate your BMI, we can understand by this chart that where do you stand. So 18 to 25 being normal, and above which it is different classes of obesity. So we have different classes of obesity come into the OPD, and we always see patients who are above class 3 and even super obese category. So that's how obesity is rising. The another important aspect is obesity in childhood. So World Health Organization has really sent out cautions that childhood obesity is on a rise, and if you go by the numbers, by the end of 2030, 27 million school children would be obese. If you see presently now, I think it's 5 to 8.8% of school children in India are right now troubling and getting bothered with obesity. The numbers are quite alarming, and if we do not take care, definitely childhood obesity would be on a rise. Adult obesity is already causing a lot of trouble. Childhood obesity again becomes an issue because these patients, these kids, are on a verge of getting early onset of diabetes, blood pressures, cholesterol issues, and the list goes on and on. So, if we are aware of the fact that what obesity is and how we can treat it, definitely that will make a lot of difference. And that's what on this World Health Day, I want to make people aware of obesity in adults in childhood, and what could be the reasons, what could be the treatment options, and how we can get rid of obesity and its complications. Now, once we know what is obesity and how we can calculate, there are multiple ways where we can actually prevent obesity. See, prevention is always better than the cure. My role as a surgeon comes in the end when everything fails and these patients are not able to lose their weight with diet, exercise, even for that matter, medication. Then my role comes into practice wherein I can do a surgery and get this patient's weight down. Now, initial aspect, surgery is always really scary for all the patients because for weight loss surgery, it's always taken with a pinch of salt. But it's not the case because what happens is if the patient has some kind of pain, they reach to the hospital, they want to get rid of this pain as soon as possible. But what happens with obesity is that they get compromised situation and they are used to that particular living with obesity. Now, for example, if the patient is on higher side of the weight and he develops diabetes because of that, he would start with always an OHA. Later on, they start insulin. And in case if the sugars are not coming down, they'll try to increase the dose of insulin, but they'll forget to treat obesity as the main cause. Now, for people who are heavier on the weight, walking would be difficult. They'll have shortness of breath, but they rather take a lift instead of thinking that weight can also be reduced. Now, what happens is at some particular time, the threshold is so high that the patients they stop doing anything. Because see, for an example, a patient is of 50 kgs idle weight, but he is excess 50 kgs. That means the patient's weight gain has happened of 50 kgs and is 100 at the moment. When you tell this patient to walk every day, it becomes quite difficult for them to carry that excess 50 kg baggage and do all the activities. So physical limitations because of the weight again should be considered and should not be looked upon down by the relatives. See, what happens is when these patients come to my OPD and when I tell them that what kind of exercises or how active you are, the relatives will always say, I had always told him to do the exercises. I've always told him to check what he's eating. But that should not be the case. These patients should not be looked upon that they are not doing anything. They are at this particular stature in their life that it's difficult for them to do those kind of exercises. So what I always say is prevention is always better than cure. But then what if the patient has already crossed the threshold and it's difficult for them to lose weight? That is the time where we can actually do bariatric surgery. So like I was saying, these are the number of complications what obesity can cause, and that's why it is called as mother of all diseases. Now, prevention, I think Rajeshri would throw a better light on the nutrition aspect of prevention. But this is what in India we should follow this food pyramid, wherein 40% of your things should be a cereal, 35% should be a vegetable, 20% should be a fish, meat, proteins, and only 5% should be your fat, oil, and sweets. So that's how the food pyramid is. And if you have a balanced diet, definitely prevention is the thing. Now, when you talk about bariatric surgery, which is the main thing, main crux of this talk, is what exactly it is and how we can incorporate surgery to lose weight. So it's not a cosmetic surgery. Definitely, it is not a cosmetic surgery, which was considered before. And it's the last option for patients who are not able to lose weight with diet, exercise, and the medications alone. Sometimes it should be the first option for patients who are struggling with obesity. Because by the time they reach my OPD, they are all exhausted with all the medications, with all the let's say, conservative ways of losing weight. And by the time they reach, they are already in a state where they are on high doses of insulin. They are on the machine for sleeping, such as CPAP or a BiPAP. But yes, definitely there's a solution. Now, these are the criteria wherein which we can undergo bariatric surgery. Like the patient BMI is greater than 35 without any comorbidities, these patients can undergo bariatric surgery. If the patient's BMI is above 30, then also these patients can undergo bariatric surgery. The last is very important with the BMI of 27.5. So leaner patients also, if the sugars are not controlled with high doses of insulin and OHAs, these patients can also undergo bariatric surgery. In that case, we are talking about metabolic surgery for the diabetes reversal. And that's why it is called as bariatric and metabolic surgery. In other words, it can also be called as diabetes reversal surgery. Now, what we do in this surgery is in common language. I mean, not stressing upon what exactly is the surgery, but in simple terms, we decrease the size of the stomach, or we attach a portion of intestine to it. By decreasing the size, attaching the portion of intestine, we do a malabsorption. So in here, what you see in this picture is this is the restriction by cutting the stomach into more than 90%. So ideally, the capacity of stomach is around 1 to 1.5 liters. And when we do a sleeve gastrectomy, we decrease the size of the stomach to around 70 to 150 ml. Now, we can also put in a balloon and restrict the amount of fluid. We can also suture the stomach from inside and decrease the quantity of the stomach. What happens when you do a restrictive surgery? Restrictive, in clear terms, is decreasing the size of the stomach. So when you decrease the size of the stomach, the amount of food the patient can have will also be decreased. So what is the result of that? The calorie consumption goes down. And for example, if the patient or any other individual, let's say a normal individual should have 2000 calories. So when you decrease the size of the stomach, we narrow it so down that maximum 800 calories approx the patient can have. Now, when the body requires 2000 and we are making the size of the stomach small so that the patient can have only 800, the body is falling short of 1200 calories, and these 1200 calories would be achieved by breaking the fat which are already deposited in the body, and that's how the patient starts losing weight. So in common sense, in common terms, the patient eats less, he's more active, he's losing weight also at the same time, and he's not hungry. That's what the benefit of surgery is, and that's sleeve. Malabsorption is, again, we decrease the size of the stomach to around 80 ml or so, and we attach a portion of intestine so that the food directly enters into the small intestine, bypassing the stomach and the small intestine, which is called as a malabsorption. Now, when you do a malabsorption, another is a Roux-en-Y gastric bypass. Again, the stomach sizes are approximately around 25 to 30 ml, and we attach a portion of intestine, and we bypass this particular segment. So, concept of bypass or malabsorption in bariatric surgery is that the food doesn't enter into that portion where the maximum absorption occurs, and we create a malabsorption. So the patients eat less. Also, we create a malabsorption and the patients start losing weight. Now, when we do this malabsorptive procedures, is specifically patients who are very heavier on their weight or they are heavy, but then the sugar levels are pretty high in spite of taking high doses of insulin. So when we do a malabsorptive procedures, whereas a bypass in which is in term called as a bariatric surgery bypass, these surgeries are well indicated for patients who are higher on their sugar levels and they are highly diabetic with poor controlled because of even insulin and OHA. So yes, because of the surgery, the sugars immediately reverse on the second day of surgery and they go home without any medications for their diabetes. And that's why it is called as diabetes reversal surgery. Now, when you talk risk involved, look at this patient. He is 170 kgs walking 6 hours post surgery. This guy is 186 kgs walking 5 hours post surgery. So these are minimal invasive surgeries. There are no big cuts on the body. So these patients walk immediately after the surgery and they are discharged on the third day itself. And after going home, they are not allowed to have any bed rest because it's a minimal invasive surgery. They are made to walk every day. They can do their routine activities and they are much active in spite of the surgery. So a couple of these happy patients I would like to share on the day of World Health Day that they have documented winning over the obesity, and that's how this patient was before, and this is how she is now. She was diabetic, she was having hypertension, but this is how she is now without any medication for diabetes and hypertension. Now look at this guy. He was 186 kgs. He's now 103 kgs. Young chap, 30, 33 years, made for each other couple. If you can see this husband wife they have undergone a bypass. They are young, 30, 33 years old, couldn't conceive 7 years post the marriage because of obesity. She had hormonal imbalances. Men do have semen issues when they are heavier on their weight. So they have undergone bypasses and they are really doing good now. And definitely they'll conceive naturally also. A couple of other happy patients who have benefited a lot because of the surgery. Now, if you see the chubby chicks, these are not what a healthy female should look like. Because of this, because of the obesity, she had difficulty in breathing. So she was put on a CPAP machine. She had hypertension, diabetes, thyroid issues. This is how she is now devoid of any comorbidities and having a very healthy and better life as compared to before. This patient is quite interesting because he was on 100 units of insulin before the surgery and he was 122 kgs. That's how he is now 83 kgs and no medicines for his sugars. His sugars are completely reversed. No medicine for his hypertension and quite healthy and having a very natural and a healthy life. When you talk about age, she is by far Thane district's oldest patient to undergo bariatric surgery. She is now 73 years old. When she came to us, she was around 69 years, and with that is the way she came to us on a wheelchair. But today, she is walking on her own, doing all her activities, and having a very healthy life, devoid of any comorbidities. Now, you would be surprised to see this lady. She is only 14 years old and she was 145 kg when she came to me for the first time. So, by far, she is the youngest patient to undergo bariatric surgery in the district of Thane. She is now 3 months post the surgery, already lost 35 kgs and on a path of losing weight. So, early onset dyslipidemia, early onset obstructive sleep apnea, this is what she had and she was suffering a lot. She could not go to the school every day. Regular school was completely hampered. I rather appreciate the parents who actually thought of doing something for her because 14 years is a pretty young age, and at that particular age, when you think about weight loss surgery, is quite a difficult task for the parents. But then definitely, yes, they actually thought of doing something when they came to me. I explained them that bariatric surgery would definitely help her, and that's what they understood, and she underwent the surgery with us. So there are a couple of other patients also who have undergone the transformations. It is not just for looking good, and it's not a cosmetic surgery anymore. So if this surgery can actually decrease your diabetes levels, it can decrease your sugars, and also treat your fatty liver, your PCOD, and all those things. definitely it should not be considered as cosmetic surgery. So these are a couple of other heavy patients who have really changed their life. The way this patient, she was bedridden for 3 years, and because of obesity, she thought that whenever she'll step down, she'll never be able to get up, and that's how she was depressed, bedridden. The day when we saw her, she came in an ambulance to my OPD. I saw her and I said, definitely we would be able to help her. We got her admitted. We managed her 2 months for conservative approach because she had a lot of deficiencies. Wherever she said that there is pain, we had pathological fractures. Probably Dr. Ashish Sharwood would be able to relate what pathological and stress fractures could be in this kind of patient because she's never seen the sun. Deficiencies with vitamin D, B12, all deficiencies were creeping in. So we optimized her for 2 months and then we did a surgery. Today she is traveling alone in train, and the day when she travels alone in the train, she sends me a screenshot. She sends me a WhatsApp. I think this is what the change she has seen post the surgery. So yes, definitely bariatric surgery can help a lot of people. Now the most important aspect is the cost. Like I said, it's not a cosmetic surgery anymore, and even the government of India has well documented that bariatric surgery should be covered under insurance. If the criteria are fulfilled, these patients are legally getting their insurance. So 95% of my work is with insurance for bariatric surgery. Now, on this day, I would like to tell everyone that together we can and we should fight obesity. That's my lovely team. Uh, Everybody should take a pledge to fight obesity. Thank you so much. Thank you. If any questions, definitely we can take care of that.
Dr. Sarvi, that those were alarming numbers that you shared with us, and the fear, of course, obesity causes. It's a disease now, and the number of metabolic issues that it can cause is uh, much higher. So thank you so much for actually sharing those insights, and at the same time sharing with us how one should not fear surgeries, especially when there are life-threatening situations and also lifestyle situations. So I think thank you so much for this
Pleasure, mine.
in-depth talk. And with that, we have one more very important topic which really has to be addressed today. Again, the numbers there are rising alarmingly, and rightly so. It's Dr. Gunjan Baijal who will be sharing his insights with us. He's presently consultant radiation oncologist at the Manipal Hospital in Goa, with 2 decades of experience in high-end radiation techniques. He's trained at premier institutions like SBRT at Wake Forest University, US, KMC Manipal, and the Tata Memorial. Dr. Baijal has set up and led a team of oncology professionals at 3 IMRT and IGRT capable centers in India. He has contributed to the development of evidence-based guidelines for management of head and neck cancers in India. With our, like we said, with our modern challenges, what we eat, what environments we are exposed to, the cancer cases are rising, and there are so many newer therapies. And with the new therapies and with the rising numbers, there's also rising fear for these therapies. So Dr. Baijal, from his deep experience, is going to guide us through this difficult, tough situation, and how we can sort of weigh the risk and benefit out there. Dr. Gunjan Baijal, pleasure to have you on our World Health Day panel today. We would love to hear from you on this very complicated subject, which we all have that fear about. If you can unmute yourself.
Thank you so much, Mrs. Rajni. I won't be having slides. I'll just give something extempore to you because I'm in the hospital for an emergency right now. Basically, as the previous speaker correctly said, that the theme for World Health Day this year is my right, my health, my right. So basically, what I want to start with is by telling you that even though your health is your right, but you have to make sure that you make the right choices and feel right about them at the end of the day. And one of the very important things that has happened in our generation is the incorporation of social media, due to which there are a lot of unqualified social influencers who give out so many messages to the people. And what I want to stress here is that just because a video has got 1 million likes, does not mean that it is right. That is where the myths emanate from. So, starting at the basics, I would just like to say that cancer as a disease is basically an uncontrolled proliferation of your cells. A normal cell has a life cycle of being born, growing, performing its function, and dying. So, when these cells they lose this ability to die, they start accumulating at a place, and that gives rise to a tumor or a cancer. So, when this cancer starts and these cells keep on increasing, subsequently, at that particular area starts the fight for resources, the resources of food and nutrition for these cells. And that is when these cells decide that enough of being here. It is like when India is a huge and populous country, people start going abroad for better opportunities. So these cells, they start to migrate to other areas of the body and start to spread. And that this is a very typical characteristic of cancer. And here, what is needed to be stressed is that as long as the cancer is localized and confined to one particular area, most of these cancers are curable. So, one question which many of the patients ask is, what are the things which lead to these cancers? Or what are the common things? Why do we get cancer at the end of the day? So, what you need to understand is that the most important cause of the cancer is age. So as you age, the likelihood of cancer is increasing every day. So why that? The reason is, if you look at the life expectancy of a person at maybe say independence or post-independence, it was close to a measly 40 years. 40 years is not exactly the age when a large percentage of cancers develop, even though yes, children do have cancer, but they are very specific cancer and they are very small number of the cancers that we see of all the cancers. The major number of cancers are 50 years and beyond. So why was this life expectancy 40? So the reason was because of the increased amount of infectious disease in the society. Slowly, with antibiotics and good ICU care and everything, we were able to combat these infectious diseases very, very easily. And subsequent to that, what happened is people started living longer. And today our life expectancy has reached close to 70. And that is why we are seeing many more cancers. So this brings us to the fact of risk factors, which we can divide into modifiable and non-modifiable. So age is a non-modifiable risk factor. You can't stop growing old. You can't do anything about it. The fact that you're a woman, you can't do anything about it. And that predisposes you to things like breast cancer. The fact that you're a male person predisposes you to prostatic cancer. So these are certain things we can't change. But then there are a lot of concepts which people do not understand is about the non-modifiable risk factors, which are very, very changeable. So the simple things like cessation of smoking or not using tobacco, limiting the intake of alcohol, leading a healthy lifestyle, as was mentioned by the previous speaker, is very important, because for a large number of cancers like endometrial cancers, breast cancers, the body mass index or the weight of a person with respect to their height is a very, very important risk factor and increases the risk of a person getting cancer as they are having this. So we often say we are so stressed that we started smoking and all that. But eventually you have to toggle the risks as to why is smoking more important or living a more healthy life more important. So these are the modifiable risk factors. And if you can control these modifiable risk factors, even though you have got non-modifiable risk factors, you can substantially reduce the risk of getting a cancer. So apart from this, one of the questions which we get asked, and probably a myth is that which has been spread that genetic is a cancer, is a genetic disease. Cancer is a genetic disease, and as soon as one gets cancer, everyone is worried about their next generation. So you have to understand that even though the fact that the cells are not dying are because of certain genetic abnormalities, there are two types. One is a somatic mutation, which has probably happened in the course of your life and is not transmitted to your next generation, or you have not received it from your previous generation. And the other is the genetic mutation, which is transmissible or hereditary. That is what leads to the hereditary cancers. And these hereditary cancers are a small amount of 5% of patients. But these are slowly becoming more and more important, because as earlier people were scared of cancers, now they are coming and getting their cancers diagnosed, and we are seeing that multiple generations of patients in one particular family having similar cancers or exhibiting certain lineages. So we are able to detect these cancers and then subsequently treat the families as a whole with a lot of genetic counseling. There are certain risk reducing surgeries available. There are some chemopreventive medicines available for this family. But again, my caution here is, just because someone has been diagnosed with a cancer, don't go into this mindset that it is genetic and put the other family members through hell, that you get tested, you get tested. No, there are certain characteristics whereby, for example, a person having cancer at a younger than usual age for that particular cancer, a person having a bilateral cancer, some patients having rare cancers, or cancers being seen in multiple second generation or first generation relatives in their family. It is at that point in time that we start screening these. The most common familial cancers that we see nowadays are the breast cancers, the colorectal cancers, where we have a lot of data to suggest what kind of gene mutations are there, and based on these gene mutations, we can prescribe some kind of therapy for you, either in the preventive methods or as a therapeutic modality for these particular cancers. So that is very important from the perspective of the genetics. And coming to the treatment, of course, treatment related queries are tremendous. What one needs to realize that most of the cancers can be treated early. If they can be treated early, they are by and large very, very curable, and cure rates are in excess of 70 to 90% for most of the cancers. However, as the diagnosis becomes in a later stage, that is when the cure rates fall down. Before we start onto the actual curative modalities, it is very important to stress the fact that the common cancers, for example, like breast cancer, ovarian cancer, the cervical cancers, the colorectal cancers, all these cancers are relatively easily screenable. That is, once you have reached the point of risk, you must start to do some tests regularly in your life to see if the cancer is developing in your body. And once you see that if it is developing, so you must detect it immediately so that you can have a very productive life. So the analogy that I generally give here is that if you have an advanced cancer, you will be spending lakhs and lakhs of rupees in its treatment and getting a limited amount of lifespan, overall survival, what we call it. But whereas if you diagnose the cancer in an early stage, you will be using lesser amount of money, lesser number of modalities, lesser amount of side effects to treat that particular cancer, and yet have a very, very long and productive life. So the cost benefit ratio of treating and diagnosing a cancer early is much higher than what it is if you are wanting to diagnose it at a later stage and then start treatment. Coming to the treatment modalities, we have surgery, radiation, and chemotherapy, which are the most important. What do you need to understand here? Surgery and radiation are both curative modalities with regards to solid tumors, and each one has its own role. In some places, surgery plays a more important role, and in other places, radiation as a curative modality plays a more important role. For example, in head and neck cancer, a tumor of the tongue on the anterior side, surgery will play a very important role in cure, along with radiation as a adjuvant modality. While if you had a cancer of the posterior part of the tongue or the tonsils or the structures of the larynx, voice box, or the oropharynx, in these particular tumors, for the sake of organ conservation and good survival, radiation plays a much important role and is essentially the curative modality. For example, in the breast, surgery and radiation put together are what is called breast conservation therapy, using which we can conserve the breast for a large number of 70 to 90% of the period, which is very important for the psychological benefits of the treatment. In CA rectum, giving radiation upfront along with surgery has shown to improve survival. So these are some places where surgery and radiation are playing a very important role. Coming to chemotherapy, chemotherapy in solid tumors plays a very, very important adjuvant role of preventing the spread of the cancer to other sites. For example, in breast, we use chemotherapy along with surgery and radiation. And so much so in colon, it plays a very important adjuvant role after surgery. In stomach, CA, it does play a very important role after surgery. So these are certain things that one needs to understand. But coming to the very important concept about chemotherapy here is that many patients would come to us and say, we don't want chemotherapy because it is so toxic, this, that, and the other. What one needs to understand here is that if chemotherapy is required, it is best taken because there are a large number of good studies done to show that vis-a-vis the benefit versus the side effect, the benefits of this chemotherapy are more. But understanding this emotion of the people, we have gone into a different kind of research. It's trying to find out where we can avoid chemotherapy. So there are certain studies which came up to say that in the earliest of the cancers, say for example in the colon cancers, where you had T1 tumors, very small tumors, which were just limited to the outer surface of the colon, inner surface of the colon. Those cancers we can avoid with chemotherapy. Then we went on to breast, where we did a huge amount of research and we came up with some genetic predictive markers, which we have combined into what is called some tests for recurrence scoring, called Oncotype DX, or the Indian version of it, which is called the CanAssist. These tests can be done for specific patients. And if your recurrence risk is low, we can actually avoid the chemotherapy and safely for a large number of patients. They have got a very good predictive value for avoidance of chemotherapy. So then there are certain facts that radiation will lead to second cancer. That is not true, because radiation is actually a curative modality for cancers. This is a very different kind of radiation. We use photons, we use electrons, we use the protons nowadays for treatment of radiation. The one which is directly linked are the in the other spectrum of electromagnetic radiations, which is linked to this. With radiation induced, even if a malignancy has to develop, it develops years and years after. It must be present within the field of radiation. It does not give any effects outside the field of radiation. So there are a lot of things, and these kind of things are probably anecdotal in nature in most of the literature. It is not very, very convincing, the evidence so far for all these things. So these are certain things about the treatments that go along the way. Then one should not be bothered about losing your hair with chemotherapy and all these things, because hair regrows after the chemotherapy is done. Today there are certain things like scalp cooling devices which can reduce or sometimes even prevent the amount of hair loss that one is having. So there are a lot of things which are being done with regards to the treatment and the other things. So by and large, you must understand that this is where your treatment revolves. There's one myth which comes to us very often. My patient is of 60 years, 70 years. I don't know if he will tolerate these things. So you must understand that that is a thing which your doctor, the risk that your doctor calculates, whether he will be able to bear these treatments. And by and large, for example, if there are medical comorbidities due to which in a particular cancer surgery is not possible, for those tumors we have reserved radiation. So you see, you have to understand the overall toxicity of these things like chemotherapy and radiation are probably lesser in nature, or they are more milder, or their tolerability is better very often. And that is why these things are reserved for such patients. So we should not just take a random decision because we heard something on a social media platform which had more than 10,000 likes versus only one fellow, the doctor, sitting there and saying that you'll be able to do it. You have to realize that the doctor is more qualified and more experienced to take these decisions for you. You have to trust your doctor sometime at some point in time. So even though your health is your right and you can do whatever you choose with it, but make sure you involve the right people to take those right decisions for your rights. Thank you. Thank you. With that, I'll just close right now. Thank you.
Dr. Gunjan Baijal, thank you so much for actually joining in despite you having an emergency at the back of your mind, and of course in the hospital that you are. But you hit the nail right by saying that, just because just that you have so many millions of views, that's one reason why True Wealth as a platform was created, so that we could really get the authentic healthcare professionals here to share the right knowledge with people here. And rightly so, you're here today sharing all these different facts with the audience here. So really thank you for taking the time out. I think you did explain very much in a very easy language as what is cancer really, and what are the different treatments that are there, and the myths around which treatment for which cancers. And as you always reiterate, saying that early detection and early treatment is the most important thing out here. Just as emergency care, it's equally as important in the case of cancer. So thank you so much for sharing such great insights, and we are looking forward to actually having more talks with you, so that we can get more detailed knowledge about different cancers from your vast experience.
Yeah, it is a very vast subject, and to just wrap it up in 10 minutes is very difficult. Absolutely. But I'm still thankful for the opportunity.
Sure.
And I think I'll take your leave now because I have got to rush.
Yes, sure.
Thank you so much for having me on the
Thank you so much.
Thank you.
Yeah. Okay. So I think with that, I think we come to another beautiful topic, I would say, and beautiful again because it's about women health. And we have Dr. Snehal Phungshe with us. She is practicing for gynecology and obstetrics at the ONP hospital in Shivaji Nagar and Veela Hospital in PCMC. She does a lot of work in the infertility as well. She has been ex-assistant professor at the Sassoon Hospital and has specialized in gynecology from the prestigious Grand Medical College, that is the JJ Hospital, and MBBS from JJ Medical College. Dr. Snehal Phungshe, so happy to have you on our platform first time, and I know you're going to deep dive into women health, which is very important because it's not only about the woman, her own health, but also the health of generations to come. And I think both of them gets ignored when the woman is not looking after her health. So looking forward to what you want to share out here today.
Yeah. Hello, everyone. So today, as Dr. Salvi said, as Dr. Gunjan said, there is World Health Day, and for every World Health Day, there is some theme. So this year is My Health, My Right. So what does it mean? Is my health, my right? Means if suppose I'm having any health issues, then any related queries, those queries should be solved. And for that, what is very, very necessary is you should contact right doctor at right time. So today I will be talking about women's health. Yeah, as Rajeshri madam said, it's very, very important. Women's health is very important. Why? Because somehow nowadays we see that women are prioritizing others in their life. So in a rush of making everyone in their life happy, somehow they neglect their health. So that's why we are going to talk about women's health today. See, my patients, all patients are females only, except for the infertility couples when we give treatment for the couples. But when they come for the visits, they contact doctors. But suppose some patient is having irregular bleeding or heavy menstrual bleeding, that complaint must have been for last 6 months, 7 months. And when those things become unbearable, that time only they come to doctors. So first important message I want to give is, do not take your health lightly. Whenever you are having some symptom, it is distressing, you should contact your nearby doctor, your friendly gynec doctor. So I would like to share a presentation now. So I will be talking today about two topics. First, which is very important in adolescent, in a young age, that is PCOS. And second, which is very distressing, that is a phase at the later age, that is menopause. Okay, so PCOS generally it starts around 20 to 30 years of age. And you must have heard about the PCOS symptoms. That common symptoms are, there are irregular periods, there is so much of hair fall, there will be excessive hair growth, there will be rapid weight gain, which is out of control. Then there will be problem of acne. The young ladies will apply so many creams, but acne are not going. So what happens, mainly because of social media, as Dr. Gunjan rightly said, there is so much influence of social media. Young girls and their mothers know that there is irregular period, there is something relation with PCOS. So without consulting doctors, they label themselves as PCOS. So this is not right. Every girl with irregular periods is not having PCOS. Yeah, there is high chance that you being diagnosed with PCOS, but it's not case with every girl, because there are so many other things, like if you're having some thyroid issues, if the specific hormone which is called as prolactin is higher in your body, then there can be problem of acne, there can be excessive hair fall, excessive weight gain, and along with that you can have irregular periods. And for PCOS, what we advise is just lifestyle modification first. And if you are having some thyroid issues and prolactin issues and you are ignoring it, it will not be treated with just lifestyle modification. So my advice will be, if you are having irregular periods, consistently you are having irregular periods, you should contact your gynecologist before labeling yourself as having PCOS. Second important point about PCOS is, every PCOS patient, suppose you have been diagnosed with PCOS, every PCOS patient and their relatives want permanent treatment. So here comes the psychological impact of PCOS. The girl who has been diagnosed with PCOS will be worried, but one who will be more worried about the PCOS thing will be her mother. So many times mothers take their daughters to me and they ask, doctor, is there permanent treatment for PCOS? Because what questions they have in their mind is, will she be having some infertility issues later? Will she be having issues in her marriage because of irregular periods? So the answer to it, for permanent treatment, yes, there is permanent treatment for PCOS, but not just medications. You have to play important major role in it. That is, you should be able to do specific lifestyle modifications and not for specific period. So for that, we compare PCOS with diabetes. In diabetes and PCOS, in both there is insulin resistance. Means the body, because of insulin resistance, whatever sugar is inside your body is not able to use it. So if we take the example of diabetic patient, suppose one patient is diabetic, that patient is on insulin or whatever oral meds. With diet and specific medications, your sugar will be controlled. But it is not a final treatment. Suppose you think, okay, now my sugars are treated, now I can eat any sweet food. No, your sugars are again going to be abnormal. The same thing happens with PCOS. What commonly happens with girls is till their periods become regular ones, they follow diet, they follow exercise, and whatever we advise today. And once they achieve the regular periods, again they start eating junk food, they skip exercises. It's not gonna work. Again, you will have the symptoms of PCOS. So, for permanent treatment of PCOS, you should follow the lifestyle modification and for the whole life. It's not for the specific period like 1 or 2 years. So, what treatment options are available? First, you should not be stressed about it. Whatever weight loss we advise you, it's gonna take time because the fat in PCOS is very resistant. You may have to work out more. Next is dietary changes. I'm not mentioning here diet. You should not start eating just salads and sprout. You can have your daily diet, what you have. In Maharashtrians, we have pori, bhaji, varan bhat. That things you can have. What you should avoid first when you are doing dietary changes is try to avoid fine sugars in your diet. Try to avoid sweetened sodas and drinks. Try to avoid bakery products. And once you are able to control your urges, then you can decrease the amount of rice in your diet. You can increase the amount of salads. You can increase the amount of protein in your diet. Next is the right exercise. See, just doing yoga, meditation is important, but just doing yoga will not help for PCOS. Why? Because you need to do some aerobic exercise. You should sweat after doing exercise. That's very, very important. Many times patients come to me, they say, doctor, I'm doing exercise. When I ask what you exercise you do, they just say, I do walking, I do yoga. No, it's not going to work. You should do strenuous aerobic exercise at least for 30 to 45 minutes to reduce weight. Then adequate sleep is also important. And when we see that the hormone, when we are suspecting the patient with PCOS, we run a few tests for them. And when we see that the hormonal imbalance is very much more and that patient needs supplements, at that time we add supplement to that patient. When the medical treatment or the hormonal treatment is needed, see, the important thing I would like to tell is whatever may be reason, you should not skip your periods for more than 2 months. Forget about a pregnancy, but if you're a college going girl and because of PCOS, you are continuously skipping your periods every for 2 months, for 3 months, it's not right. So if spontaneously you are not having your periods in 2 months, you should contact your gynec and you should take proper pills, which we give hormonal pills for 5 days or 7 days to have your periods. So in PCOS, we give hormonal treatment only when it is necessary. Related to infertility issues about PCOS, every PCOS patient is not going to require infertility treatment. Every PCOS patient is not going to require IVF. Yeah, there can be difficulties in achieving pregnancy, but many patients conceive with ovulation monitoring, with some amount of drugs, etc. So every PCOS patient is not going to require IVF. Then we will come to the menopause. Menopause is the second thing, which has the physical, along with that, there is so much of psychological impact. And we should understand that menopause is not like infection. No, we have respiratory infection, we have fever, we take meds for 5 or 7 days, we do the antibiotic course and done. The infection is cured. Menopause is not like that. Menopause is a process in which your body is adjusting to the change in the hormonal status. So what exactly happens in menopause is menopausal age can be different for different women. Average age in Indian women is around 51 years. But whenever you are having menopause, what happens is your ovaries stop functioning. It means your ovaries stop producing estrogen. And because your body is not getting estrogen, whatever symptoms you are having, those are because your body is lacking estrogen. That's why you are having those symptoms. So what are the common symptoms? These are vaginal dryness. There can be significant vaginal dryness. You can have a little pain at the time of having relations. Many times women are very shy, about this, that they're menopausal and how to contact doctor about relations issues. But this is very significant, and what is important is there is treatment for that. If you take proper creams, you take proper medicines for that, this vaginal dryness can be temporarily treated. Then the next common thing is repeated urinary infection. Next, there is increased risk of cardiovascular complications. There is increased risk of osteoporosis, that is loss of calcium from the bones. The bone becomes very brittle. There are high chances of fractures after menopause. Then there is significantly decreased libido. There is forgetfulness, irritability, and the significant and the specific about menopause is this hot flushes. What is hot flushes is suddenly you will feel extreme heat in your body, and suddenly you will start sweating, and it is very distressing. Trust me, if you are having any menopausal or perimenopausal women, don't make fun of it. She is going through a lot. It is really really distressing. She is becoming irritable because her hormones are talking. She is not doing it purposefully. Many times people make fun of it when there is a menopausal woman, and when she suddenly become irritable, then they tell like, okay, don't just ignore her, she's menopause. No, suppose it is very distressing for her, she should contact gynecologist. And every symptom I have mentioned here there is treatment for that. The important thing what you have to do is just to contact your gynec and to take right treatment. What nutritional add-ons you can take after menopause is, first important is the soybean and soy products. Why? Because it contains phytoestrogen. In simple language, I will say what phytoestrogen will do is like it is hormone replacement therapy, but with very, very, very less side effects. So you should include soybean products, soy products like tofu, then soy milk in your diet. You should increase nuts intake in your diet, because it is proven that when you eat nuts, then they increase the endorphins in your body and help to elevate your mood. And legumes, of course, you should have protein rich diet, and legumes help you with that. So that's all about it. Thank you, Rajeshri madam, for giving me this wonderful opportunity. So
Well, I am so glad that you shared two main aspects, which of course are very close to my heart as well. When it comes to infertility, of course, PCOS, because it is going to have a lasting impact not only on the current but the future generations, and of course, menopause, which is so much ununderstood, and every woman goes through a different menopause, and to be able to support her is absolutely a right thing to do. How to do it is, of course, we should visit a gynecologist so that we have a better understanding of the situation and how to actually deal with it ourselves, and of course with our family members as well. So really, thank you, Dr. Pongshe, for sharing those insights. And last but not the least, we have we have a final speaker who is also one of the True Wealth esteemed panel members, and that is Dr. Ashish Arbat, who is currently the head of department of orthopedics at the coveted ONP hospital and the consultant orthopedic surgeon at the very respected Jahangir Hospital. He has treated an astonishing number of 5,000 plus patients using innovative techniques over the past 2 decades, establishing himself as a pioneer in the field of 3D AI-based robotic joint replacement surgeries in India, with MS in orthopedics from the well-respected KM Hospital and MCH orthopedics from the Royal College of Surgeons. His overseas fellowships from Princeton University, US, and Funabashi Sports Medicine Center in Japan contribute to his international acclaim. While all the healthcare providers are doing so much for their patients, and all of you all shared so much for the audience here, Dr. Arbat is actually going to address the very vital aspects of fitness and health, especially the fitness and health aspects for the healthcare providers themselves. And which are, of course, really going to be insightful for the viewers as well. But I'm happy that he's going to share these insights with us. So over to him.
So, hello and welcome. Hello, Rajeshri, and the viewers and my colleagues. This is the first series of lecture from True Wealth for 2024. Hope it finds everyone in good health. And on the day of World Health Day, as a sports surgeon and as a joint replacement surgeon, I would like to put forth my experiences, personal as well as the lot of geriatric and young crowd that I'm seeing as patients, and many of them have turned to be doctors. I would like to divide health into two major zones for doctors, healthcare professionals: physical and mental. In talking about physical health, Rajeshri, what I have seen is many of the doctors suffer from lack of muscle mass. Everybody talks about bone health and a lot of stuff, and me being an orthopedic surgeon definitely would emphasize on that. But the consciousness and awareness of bone health is a bit good compared to the muscle health. We have 206 bones, but more than 3,600 muscles in the body, and nobody talks about them. So the condition known as sarcopenia, like you have leukopenia, like you have chondromalacia, you will have sarcopenia, the lack of adequate muscle mass, the red muscle mass. And why it starts? It starts with improper nutrition. Definitely genetics have a role to play. So here I would like to emphasize the three main types of bodies that all of us have: the ectomorphic body, the endomorphic body, and the mesomorphic body. Nevertheless, when it is an ectomorphic body, example, Shah Rukh Khan has an ectomorphic body. In these kind of individuals, the muscle mass is less, but it's more flexible. So a healthcare profession who has that kind of body, sarcopenia in them would be defined as lack of flexibility, not the thickness of the muscle, the length of the muscle. Endomorphic bodies are the bodies which are well-rounded personalities, like most of the doctors have, more fat content. These kind of bodies, example, the body of Govinda, just to give an example, they should resort to more of cardio, stretches, and lack of adequate proteins will give them sarcopenia, because most of them are heavy in their carbohydrate intake. And third type of body is the mesomorphic body. The bodies are most of the heavily built actors like Akshay Kumar, genetically strong bodies, but these bodies stand in the verge of having a poor heart health because the high BMR body. So understanding your body as doctors is also very important. We are exposed to a lot of physical stress as surgeons, as clinicians every day. Lack of timing of food, lack of proper nutrition. So here health doesn't mean that you are having six packs or you are a hugely built person. Understanding your body, the requirements of nutrition. And I would add to it, Rajeshri, that every 5 years, I keep on telling my juniors or my students that every 5 years of your life, what you need to do is unlearn. Not to learn, unlearn the negatives that you have. There are times from say 20 to 25, especially the male doctors, that tend to de-stress with kinds of smoking, resort to drinking or whatever. So in the first decade, slowly need to unlearn that this is going to increase my homocysteine. This is going to hamper my digestion, my dietary habits. So 25 to 30, we should resort to some form of strength training exercises. Find time to do that. Have a mental preparation that as I need a good brain, good mind, I need a healthy body. And what does a healthy body mean? That you don't get tired and your internal organs are normal. So definitely that starts with your gut, taking care of eating at the right time and the right food. Ectomorphs should resort more to having proteinaceous diet, lot of fibers, and they should not think about bulking it up. Because if they bulk up, if they become fat, the ectomorphs, they have a huge chance of getting cardiac arrest, nevertheless hypertension and other things. The physicians are mostly falling in this criteria because naturally there are petite people. They are gentlemanly and soft. They have ectomorphic body. I would advise them to resort to yoga, Tai Chi, and the martial arts if possible. Swimming is an excellent exercise for them. Eating good amount of proteins, taking care of their vitamin B12 levels, vitamin D3 levels, checking every 3 monthly. They're less, and also check your homocysteine levels. That is the commonest cause of heart attacks in young doctors. No or very limited form of alcohol is very, very, very important. Now coming to the endomorphic form of your body, I've seen most of the physicians, most of the general surgeons and that group having these kind of bodies. And I'm not a generalize, that's what we have seen. And a high carbohydrate diet is a killer for them. They should restrict their carbs, resort more to good fats, control the level of alcohol in the sweets that they eat, and checking your B12, D3 levels, resorting to exercises of strength training, weight training will definitely help because they, under the skin and in between these muscles, they resort to having a lot of fat. And this fat gives them to pseudo sarcopenia, the lack of muscles in volume. So to increase that, they should always do strength training. The mesomorphic people are mostly the surgeons and the people who are very actively involved in heavy work. For them, relaxing exercises are very important. What happens after a heavy day work or a long OT, you try to end up in a gym just because you feel that strength training will help you. Definitely it will help, but strength training should be done on the day when you are really have no huge physical exercises or physical work. So here you should resort to Surya Namaskara and all the forms of yoga and strength training only 3 days a week. Again, they stand a very high chance of high homocysteine levels, and lack of vitamin B12 is an absolute killer for them. So never work out on a tired body. They might start a day with a good cardio, resorting to less of heavy weights, more of repetitions of medium weight will resolve the problem of sarcopenia. In women, again, the similar type of bodies are seen. They turn into endomorphic bodies mostly post-pregnancy. So that period of the women who tend to put on a lot of weight after pregnancy, losing it becomes an equal responsibility for their physical health because they turned into sarcopenics. But nevertheless, women luckily have hormonal blessings for the first couple of years of life till their menopause. And that's the reason they tend to work out less. So instead of going for a fad of marathon or that kind of stuff, resorting to strength training always will help women to decrease the sarcopenia because they are naturally sarcopenic. 70% of weight that you can take, number of repetitions to be more is the key. One more exercise that helps them is cycling because it's the lower body that they need to work out more. So leg days have to be more than the chest and upper body because women tend to have a lot of problems of varicose veins. I've seen a lot of doctors having DVT and varicose veins, especially the gynecs and the surgeon and the women who post-pregnancy do that. So in the operation theater, we advise and we also follow it that we wear DVT stockings for all cases. And like you said, we have to unlearn. So 30 to 35 and 35 to 40 is the time when you need to, every 6 monthly, check the internal organs. Get a sonography done, get a 2D echo done, check your BMI, check your body mass index, see the fat content, see the visceral fat, especially the endomorphic women. Check the visceral fat, and that is one reason, abdominal girth. So sarcopenia is a very serious topic, Rajeshri, and your product with the Flexi Food and the Forti Food are really well-balanced diet. In the age group of 40 to 45 and 45 to 50, we should, I think, get off alcohol, reduce it to negligible, and resort to some digestive elements like pancreas, which will help you to digest the food more. Always measure what you eat healthy, and processed foods to be avoided because there comes the question of more of tendinitis in this kind of age group, which I have seen, and especially in doctors who are really running pillar to post and doing good to the society, but they need to always take care of themselves. And definitely post 50, the great rat race that we all are running in, we should understand that we should understand the nuances of healthcare, that as a doctor, you should be healthy first. In talking about the other topic, the other vertical that I was talking is mental health. Mental health, I'll divide into two things. Mental health is not always being feeling good or positive. Mental health is, again, what I said, is unlearning and acting your age. It happens that all of us start our career very late, early 30s. And that is a time when we really are running pillar to post, managing our careers in various forms. But we should understand that somewhere we have to be conscious about our overall health because it's very stressful out there. We are the people who take most negative part of the human life cycle because everybody comes and complains to us. I hardly know patients who come and say, "Doc, how are you feeling today?" Getting vaccinated for influenza yearly would save you from a lot of flus, a lot of absentia from work. That will take care of a lot of your viral issues. It is okay to get off. I've seen a lot of big doctors in between the OPD, they stop the OPD for time and have their food and then restart. 1.5 hour after food, it becomes mandatory that you go walk, do some form of physical work if you're an OPD person, if you're a general practitioner. 1.5 hour after food, go for a walk. Burn those, because that's the time when your insulin is released. That is a time when your body will utilize the hormones released for digestion if you are doing some physical activity. And like I mentioned, always have some supplements. Third part is in the mental health, it's mostly hormonal. Getting good sleep. Post 40, post 50, getting adequate amount of 6 to 8 hours of sleep is very important. And I would recommend them to take Melocet, high fiber and protein diet in the evening. Getting good quality sleep, then the length of the sleep is very important. Diurnal variations in people working in the ICU and stuff always takes a toll on the health. So no ICU duties for more than 3 days a week. And eat less during this and resort to the safe hormone Melocet when you try to sleep and get that adequate body rest. Talking about mental health again, all of us somewhere should understand and draw a line that we are not God, we are not nature, we have limitations, and respecting the limitations and being realistic to them is very important. Giving 100% doesn't mean we start playing God, and that is a major reason of stress in most of the doctors. Definitely not being casual about it, but being reasonably understanding that we have a responsibility to ourselves also. RSG Nutrition is doing an excellent work because most of their products are nutrition based. An excellent one of the product that I keep on using is that on a tired day, take the recharge, start your day with it. You'll get all the electrolytes in an effervescent form. We should limit the number of cups of coffee or tea that we have. Overall, being very conscious about your physical self every 5 yearly. Understanding that your body is just 32 days old. Your bones are 24 days old. They keep on remodeling. Your blood is 30 days old, might be. Your immune system is 60 days old. So you cannot be a 22-year-old in your head when you're 55. You should understand that you're 55. And those who are conscious about it really have understood the ikigai of life. It has been lot said that it's a noble profession and everything, but on the World Health Day, especially for the healthcare professionals, taking care of yourself, I guess, becomes the primary responsibility, because if you are healthy, you're going to save lakhs and lakhs of human beings. On this note, I should be thanking RSG Nutrition, True Wealth, and many other programs to come. And I wish everyone a very healthy year ahead, mentally, physically, morally, and financially. Taking care of your health, take it as a responsibility. Take it as a love to yourself. Loving oneself and absolutely not being narcissist about it is very, very important, because there are a lot of expectations from your smiling face. And to smile, you really have to be happy within. And to be happy, we have to be healthy within. So I thank you, Rajeshri, for giving me this opportunity to talk here. Like every time, I wish you all the best. And I wish all the speakers today to have a good, healthy 2024. Thank you.
Thank you so much, Dr. Ashish Arbat, for such a complete talk that you really shared all those insights, how we take care of our physical fitness as well as our mental fitness. So, very important for us as healthcare professionals, and like you rightly said, love yourself. Love, laughter, and life is something which I'm also going to reiterate in my talk. But thank you again for all that, for a complete talk that you've given us and drawn the attention towards this noble profession. So, on this World Health Day, let's all of us wish these healthcare professionals very good health and happiness as they keep doing that for us day in, day out. With that, I would like to share a few insights from my side on the nutrition aspect. You know, nutrition is one thing, but I, of course, believe in a more integrative approach. So, um, earlier speakers, and Dr. Prashant Salvi also shared that, we need to have a balanced diet. So we always keep talking about having high protein diet, a low glycemic index carbohydrate meal, and I keep saying that don't shy away from fats, but have good fats because good fats can take care of, or rather help reduce the bad fat in your body. So these three aspects, while they are so important, it's also very important to hydrate yourself. Having said all this and keeping your diet high on fiber, there's one very important balance that I would like to bring everyone's attention to is the balance of alkaline and acidic foods. And acidic foods comprise mainly of proteins. So when we eat a lot of proteins, we have to balance that with a lot of fiber, bit of carbs. So it becomes balanced in terms of alkaline and acidic nature of foods as well. This includes, neutral foods like fats, starches. Do not, of course, resort to raw sugars because they are, of course, going to, affect you, and especially if you have any metabolic diseases. But if all of that can be eaten with good balance and in controlled quantities, uh, those are not going to cause you harm. And the alkaline foods, the most important ones, which I see these days, a lot of people don't like to eat fruits and vegetables, legumes, nuts. These have to be consumed, but fruits is something you completely shy away from. A lot of people have myths that if they have diabetes, they should not be eating fruits, but eating the right foods at the right time is very important for all of us. And in fact, even for the healthcare professionals to their hectic routines, because huge amount of antioxidants that help take away the free radicals inside our body, which are really causing a lot of the inflammatory diseases and also the autoimmune diseases. So this can really help us prevent. So I just want to share a few thoughts which you can take away. One is, of course, eating a lot of fruits, staying away from these three notorious items. Bring down the sodium, the salt content in your food. Try to avoid raw sugars and try to consume more low glycemic index foods for getting your carbohydrates and energy needs. And stay away from trans fats absolutely, and keep saturated fats at lower minimum in your foods. So having said that, I also would want to bring your attention, like for every disease or every issue that we have, we go to the professionals. For your nutrition needs, do go to the nutritionists, the nutrition experts. Will be able to guide you holistically, will help you set your goals right with marrying them with whatever is your medical or surgical treatment. So it's very important that these aspects need to be integrated. At the same time, your nutrition plan has to be very, very personalized. What works for one does not work for the other. And also because everyone has different professions, different daily requirements, and different energy, protein, hormonal requirements, all of them will have to be tackled in a very tailor-made fashion. So make sure that you do that, and that's what we do in our everyday practice, trying to help our patients getting these specialized personalized meals. And why? Because they need to have the right balance of macronutrients. They have to correct the micronutrient deficiencies, eliminate foods when required, and bring them back into the routine. So all this has to be done with a very detailed approach. There are so many foods, there are so many elements to the nutrients that actually getting the right matrix is an exceptionally difficult job. It's not something that you watched over social media or Googled something and just try to implement it in yourself. Very difficult. And lastly, but not the least, the most important aspect is which Dr. Salvi also mentioned, that that we have to resort to balanced diets, but actual counseling and making sure that the diets are followed or the nutritional plans are followed. Regular monitoring and counseling is very important. Sticking to your plans and being consistent about doing it, making it a part of your lifestyle, is what is exceptionally important. Last but not the least, what I would actually sort of share as concluding remarks is, by adopting an integrative and personalized approach that encompasses medical management, surgical procedures, nutrition counseling, physical activity management, mindfulness, and complementary therapies. Putting all this together, it is going to benefit our society at a large and can achieve better treatment outcomes, overall health, and foster a lasting well-being for the present and future generations to come. Building faith and strong relationships between patients and healthcare providers is one very important aspect, and that gap is something which True Health is trying to bridge, and especially as WHO was highlighting this year that my health, my right. It's very important. With right, there comes responsibilities. So collaboration between patients, healthcare providers, and interdisciplinary teams, tailoring treatment plans, meeting individual needs, preferences, and circumstances can empower individuals to manage and maintain good health and lead more fulfilling lives. With that, I think we do have a few questions, which I'm just going to quickly bombard at our speakers. One question for Dr. Amit Komne is, how important is it to act fast, and what is the type of medical center or other hospital one should choose to get admitted into in case of emergency? Dr. Komne, if you can unmute yourself. Should I repeat the question?
Yeah. I got the question. Thank you. Thank you, Rajesh. So what kind of a medical setup you should aim at the time of an emergency? So it depends on multiple factors, right? What kind of place you live in, right? Whether you are in interiors of your state, whether are you in a metropolitan city, and so it all boils down to emergency is time. It is a race against time. So whichever tertiary care setup available to your place, the nearest place is advisable to get into a times of an emergency. And if the tertiary care is not available, what I mean by tertiary care is a kind of a multi-specialty hospital under one roof, where most of the specialists will be available. And if you're not able to get to a tertiary care, even a secondary or a primary care center, if it is nearest to you, if you're not able to reach, can help in best times. Many a times, what we do is we keep on calling places and try to reach places. But then in such cases, it wastes a lot of time. So just getting to the tertiary care center where if they are unable to arrange, or where primary care center where they are unable to arrange, they can at least arrange a safe transport of the patient after giving a basic care or a life-saving care, and then the transport can be arranged. So rather than aiming at a very quaternary care or a bigger setup or kind of that, the best possible thing in an emergency is to reach to the nearest best medical facility that they have. Yeah. Rajesh, you are muted.
Sorry. One more question for you. Is busy ICUs need very strict transfer in and transfer out criteria? What is the most important health parameter that decides that the ICU patients need to stay in the ICU?
Okay. So the admission and admission out criteria were recently highlighted even by Government of India 4 months back in a transcript that was made by the premier institutes and even the Indian Society of Critical Care Medicine, and that also came on to the front page of Times of India newspaper, that the transit and trans out criteria for ICU needs to be standardized all over the country. I was in United Kingdom for some time, worked with NHS, and then the criteria there are very stringent. Even in the US, for that matter, the criteria are very stringent for who should get into the ICU and when should get into the ICU and when the one should get out of the ICU. And there is no ambiguity about that, and there is no other uh, consultant or the specialist who make an opinion. There are the very stringent criteria which are laid down. Even a paramedic or even the ICU manager or even the ICU head nurse can take a call about who is needed in the ICU. So usually organ system failures that we take in. Okay. For example, a patient having one or more organ which is failing or impending to fail or is about to fail or is about to dysfunction is a time where we need to wheel them inside the ICU for better monitoring and better care approach. And once the organ systems or the organ has recovered from its baseline, then we can ship them out to the ICU in nutshell. Otherwise, there are very much stringent point by point criteria laid down. And the book and the guidelines are available even on the Government of India, Ministry of Health and Family Welfare websites as well now. Yeah.
Great. That question did come from Dr. Rekha Bhatkande. So yeah, that's why it was so detailed. She's dean with the Sushrishta Hospital in Mumbai. So thank you to her for the
Thank you.
question, and thank you for the answer, Dr. Komni. The next question, of course, is for Dr. Sarvi. Is that there is normally, Dr. Sarvi,
Yeah, I'm there. Yeah.
so the question is that there is normally a worry about eating well after the surgery, basically after a bariatric surgery is done. Most people worry about what will happen after the surgery, and especially what they should eat. So is use of protein and vitamin mineral supplements really very critical post surgically, and how long they should be on it?
Correct. So, like I said before, also bariatric surgery is just a second chance, and prevention is always first criteria. So here also post-surgery prevention is the first criteria, so that these patients do not have any deficiencies. See, whenever if you see any obese patient and you get your vitamin B12 and D3 level, they'll definitely be very low. Now, when you decrease the size of the stomach, the amount of food they'll have, that also will be very less. So the amount of nutrition they would be receiving, that also will be very less. So when you do a sleeve gastrectomy, wherein you decrease the size of the stomach only, there is no malabsorption. These patients will require multivitamins and protein for at least a minimum of 2 years. Whereas when you do a bypass, these patients will be always having a malabsorption because we have created a malabsorption in these patients. So these patients will require multivitamins, a combination of B12 calcium and protein supplements. So these protein supplements will go for lifelong in a patient which has undergone a bypass. Now, coming back to which proteins or what and how long. So, for a bypass patient, when initially we give protein supplements, like in True Wealth also, we have so many multivitamins and we have protein supplements also, which takes care of the nutrition aspects of these patients so that they do not develop any malabsorptive symptoms or deficiencies, which because of the restriction can occur. So, if these patients are on supplements and if the nutritional deficiencies do not occur, they have a very good post-operative recovery. So, like I say always, that it is not like an hernia or an appendix. The patient comes to your hospital, you operate the patient, and the patient goes away, and then you do not have the follow-up of this patient after 1 month. It's not like that. Bariatric surgery patients are lifelong. After the surgery, they become your best friend and they are going to be following up with them, with the doctor for lifelong. So we prescribe them proteins, we prescribe them multivitamins, and we also have a close follow-up, like at the end of first month, 3 months, 6 months, and yearly, we get that blood investigation done. And depends on the deficiencies or the correction, either we add a multivitamin or we decrease the protein supplements. So based on the investigations also, we can change. But by far, nutritional supplements is the backbone of any bariatric surgery program. And to avoid the muscle mass, like Dr. Arbut also mentioned about sarcopenia. So when you try losing fat, there's always 1 or 2% the muscle loss also happens. Now, to avoid that muscle loss, we require protein supplements. And in all together, when you consider surgery as well as the nutritional aspects, together the patient will have a very healthy weight loss and his muscle mass also will be retained, and it will not be a sarcopenic state post when the patient loses weight. So overall, if you ask in a one line, definitely yes, there's a role of nutrition and protein supplements which are required post bariatric surgery, and yes, they would be required lifelong if the patient undergoes a bypass, and only 2 years if the patient undergoes a sleeve gastrectomy.
Great. I like you always say that, comprehensive care, which is what you specialize in, is so
Correct.
much more important than this situation. So thank you so much again. We have one question for Dr. Pomshe, and women normally worry about taking hormone pills. Their menstruation is not right, and they are advised to be taking these hormone pills, and they feel that it's going to worsen their hormonal balance in the body. So how much true is it, and what is the risk benefit here?
Yeah, so we use hormone pills. Hormone pills is a general term. So we give hormones for many conditions, like suppose, as I said before, for PCOS. If you are not having periods for 2 months or more, then you should take some sort of hormonal pills. Then there is another hormonal pill, which is oral contraceptive pills, which we take monthly to when patient do not want to conceive pregnancy, or we prescribe oral contraceptive pills, which are hormonal pills, when patients are having heavy bleeding or irregular bleeding issues. Then another part when we can give hormonal pills is hormone replacement therapy, which we advise in menopausal patients. So hormone therapy is different for different patients. So when we consider the side effects and benefits of hormone therapy, you should hormones whenever it's very necessary. Like in PCOS patients also, suppose the patient is having her periods every 40 days or every 45 days spontaneously of her own, then I will not prescribe hormone pills because it is not needed. But if she is not having periods for 2 months or 3 months continuously, it will affect badly on her endometrium. And on long term, she may have increased risk of endometrial cancers. So at that time, if we are using hormonal pills for these patients, definitely the benefit is more than the risk. So that's the thing. So it is different. The risk benefit ratio is different for different patient. We have to analyze the condition of patient, what is need of the patient, and accordingly we should give hormonal pills only when it is needed. Suppose you are taking hormonal pills for PCOD, you are not having your regular periods, and you have to take pills which we give for bleeding for 5 to 7 days, 3 to 4 times a year. Then it's fine to have those pills. Your hormonal imbalance is not gonna worsen because of that. It will help you only. And coming to the hormone replacement therapy, which some opt for after menopause, there are so many side effects of hormone replacement therapy, like increased risk of deep vein thrombosis, DVT. So we give hormone replacement therapy specifically to those women who are having severe symptoms of menopause, like after surgical menopause, that is when at the time of hysterectomy, when the ovaries are also removed. At that time, that women will have menopausal symptoms in very much severity compared to the natural menopause women. So at that time, hormone replacement therapy is needed. That there the risk will be lesser than the benefit. So benefit will be more. But if some women are having just lighter hot flushes, or they are having just minimal vaginal issues, then at that time we try to avoid giving hormones to that patients.
Great. So I think that was a very detailed input on that. And I think women should not really worry about it and leave that worry to the gynecologist to take care of. Have the faith again, like we said. On that note, I think I will request Dr. Amit Kumne, if he is here, I would request him to conclude the session with his concluding remarks.
Hello.
Yeah.
Hello. Can you reframe the question for me, please?
No, I'm not reframing it. There's no question.
Okay.
If you can put your video on, and if you could share your concluding remarks. Otherwise, we just wanted you to close the session, if you can. And just giving you the honor to conclude such a nice session we had today.
Okay. So honor should always be to the host. I mean, okay, it was a beautiful session arranged on the occasion of World Health Day. That is today, 7th of April, 2024. And with vast variety of topics, and the topics which are very general, yet very specialized, and which need an awareness for amongst the people to take an informed choice, as the World Health Day theme suggests, right? My health, my right, and my choices, and everything. So it is really important that you have come up with these panel of esteemed speakers today, which could throw light on an awareness about the important healthcare needs of the society, including the gynec, the bariatric surgeries, and the cancer, and as well as the myths and the scare about the intensive care units and the serious illnesses that is about in the society. So thank you, Rajeshri, and the True Wealth team that you invited all of us. And on behalf of everyone, I would like to extend my heartfelt thanks again for inviting us and giving us an opportunity to present our views on the theme of the World Health Day. Thank you, Rajeshri, again.
Thank you so much, Dr. Kumne, for really coming there and sharing all the insights, and also wrapping up the session. I'm just going to thank the Energia team and play a short video of theirs in the end.